Right, time to get answers to some of your questions now, and thanks for sending them all in. Earlier I put some of them to Professor Bill Keevil, who is a virologist at the University of Southampton. John Howlett says, we've heard a lot about shortages of PPE. Is it possible to wash or disinfect it so that it can be used more than once?
Personal protective equipment is designed to be really only used once, disposable. But because the frontline healthcare workers and the care home staff have got a severe shortage, there have been reports of some of them taking their protective clothing home and washing it. Now, providing it can be washed and providing you use soapy water, then that may be okay, but of course it's not recommended.
Avalon Eastman from North Baddesley says if people are being tested for the virus, how soon will they need to be tested again? Because they can be free of the virus today but catch it tomorrow.
Well, the government said at the start of this month that once they've got all the testing ramped up to 100,000 a day, then they can test frontline workers on a regular basis, although they did not say what regular is. Now, in America, they're talking of testing once a week. And if you think about it, if people are not infected one week, they could be infected the next week. So we've really got to ramp up the testing and then test those critical staff regularly.
Caroline Krieger, she talks about age here. Was 70 chosen as an arbitrary age for warnings about heightened risk from the virus? Because, let's face it, some 70-year-olds are healthier than 50-year-olds.
Yeah, the 70-year-old age is really unfair. I know a lot of people who are very healthy at the age of 80 and beyond, whereas, we all know a lot of younger people who are very susceptible to infection, shall we say. You've even got examples of people over 100 years old surviving a COVID infection. And unfortunately, you've got very young people who do die from it. So it's very unfair. I would say it's really down to how healthy you are. If you're 80 and you're healthy and outward going, you should be fine.
Grenville Strickland says, since people have been isolating for the past 5 weeks, why is the infection rate still rising and not falling as quickly as expected?
A good question. There have been delays in the reporting, some cases taking up to a week to report back. But what we're seeing now is the infection rates going to hospital are going down, but regrettably the rates and deaths in care homes are going up.
Elliot is aged 11. We'll finish off with his question. Is it possible for pets to catch the coronavirus?
Another good question. Just a couple of cases in dogs with no evidence of transmission back to humans. A few more cases in cats, including big cats such as tigers in zoos. So again, no evidence of transmission back to humans, but watch this space.
Professor Bill Keevil, thank you very much for answering our viewers'